Hey, West Michigan, it's Rep. Scholten back for another episode of Straight Talk with Scholten. I am deeply concerned about the steep cost of healthcare, and I have heard from so many of you who are facing tough decisions to stay afloat as your paychecks become stretched thinner and thinner. Employers are anticipating the sharpest increase in medical costs in about 15 years. Higher drug costs, rising hospital prices, and greater demand for care are all contributing factors to the skyrocketing cost of healthcare in our country. And the folks being hit the hardest are everyday, hardworking Americans like you. This week, I'm going to dive into a couple of the culprits behind rising healthcare costs: rising premiums and expiring tax credits. First, let's go back about 15 years when the Affordable Care Act, or the ACA, was passed into law. This was the most significant piece of healthcare legislation in modern history. Signed under the Obama administration and sometimes referred to as Obamacare, it was not a perfect bill, but it greatly expanded health insurance coverage and reformed the insurance market in really important ways, like prohibiting the denial of coverage based on pre-existing conditions. It also made healthcare plans much more affordable to millions of Americans. One key component of the ACA were the subsidies and premium tax credits to help lower income and working class families afford coverage purchased through the marketplace. This is where Americans shop for federal and state level health insurance plans rather than private plans, which often have far higher fees than government health plans. In 2024, the average enrollee saved $705 per year on healthcare costs, equivalent to a 44% reduction in premiums. Premiums are the regular monthly payments that Americans pay for their health coverage. Many hardworking Americans cannot afford to pay for their healthcare premiums without tax credits that the ACA offered. And many would have been forced to completely forego access to basic healthcare. These income-based tax credits were expanded during COVID and set to last until the end of 2025. Millions of Americans utilized the ACA and its tax credits and subsidies to allow them to afford comprehensive healthcare plans. It was an absolute lifeline. In our home state of Michigan, 418,000 people purchased health insurance through the ACA marketplace during the 2024 open enrollment period, a record-breaking enrollment year for the state. Michiganders, like all Americans, deserve to have affordable, accessible health care without breaking the bank. Now, despite the effectiveness of these credits and how popular they are, Republican leadership in Congress is poised to let them expire at the end of the year, leaving millions of Americans on a cliff of financial uncertainty. If Republican leadership does not act to extend the healthcare premium tax credit soon, they will cease to exist. I can't stress enough, we have known about this problem for so long. They should have fixed this during the One Big Beautiful Bill. We gave them every opportunity to do so. The Congressional Budget Office has reported that premiums will rise by almost 8%, nearly $2,500 a year for a family of four with a household income of $64,000. For a typical 60-year-old couple making $82,000, the tax increase will drive up their healthcare $18,361, a devastating 22% of their income. It'll also mean $335 billion tax increase on working families over the next 10 years. Unacceptable. No one should have to choose between putting food on the table and getting health insurance. And that's not all. Around 3.8 million Americans could go completely uninsured once these expire. It's pulling the rug out from folks who need the most support. Now, West Michigan, let me give it to you straight. This does not have to happen. We still have time to act. Republicans, including President Trump, campaigned on lowering costs. But what are they actually doing now that they're in power, making costs increase for hardworking families across the country? I'm fighting back. Alongside a group of lawmakers from both sides of the aisle, we came up with a common sense solution. We introduced the Premium Tax Credit Extension Act to prevent the essential ACA tax credits from expiring, which would allow millions of Americans to retain their health coverage. This is people's livelihoods we're talking about here. There is no time to delay. It is far too important to wait until the very last minute to negotiate and sort out how millions will get their health care. We must pass this bill now. Starting in November, individuals are about to receive letters letting them know what their health insurance premiums will be. People are making their budgets for 2026 and they don't know how much their health insurance premiums are going to cost them and how much they'll have left over for basic expenses. That's why I'm fighting hard to pass this bill, but it'll need to be brought for a vote by Republican leadership in order to get through the House. Over the next coming months, we will see whether or not your health and well-being are important enough for the GOP leaders to vote on. Until then, keep staying in touch. We'll see you next time, West Michigan.